Welcome to ICU Primary Prepcast.
Hi, I'm Maddie.
Hi, I'm Swapnil, and we are back with another primary snippet. So this time we are going to dive into opioid receptor classification and their roles. Now, this question has been asked in written format, but also recently has been explored in Viva settings. So understanding opioid receptors, where they're located, and how they work, that's really important for primary candidate to understand. So, Maddie, can you please outline the classification, structure, and distribution of opioid receptors? And also, can you describe the intracellular events following opioid receptor activation?
Yep, sure. So I think this question was phrased nicely because it's easy to make a structure from it because it's got little sort of subheadings within the question. So in terms of the classification, the most common classification we use is having 4 different types of opioid receptors. So the MOP or mu opioid receptor, the DOP or delta, the COP or kappa, and the NOP, which is the most recently found opioid receptor, which is the nociceptin receptor. And this is thought to be a little bit different than the other 3 because it doesn't bind or respond to the opioid antagonist naloxone. Coming then to the structure, we know that all these opioid receptors are G protein coupled receptors. And so G protein coupled receptors consist of 7 hydrophobic transmembrane alpha helices, which are connected by 3 intracellular hydrophobic and 3 extracellular loops. And they have an extracellular N terminus and an intracellular C terminus. And the ligands for these opioid G protein coupled receptors are endogenous opioids, such as endorphins, enkephalins, nociceptin, or exogenous opioids, such as morphine. And then we know that the ligands bind to the binding pockets located within these transmembrane helices. And the binding pocket has 2 distinct regions, an intracellular part where opioids can attach, but it's non-specific for various opioids, and an extracellular part which have divergent residues that then confer selectivity to opioid receptor subtype. In terms of the distribution, opioid receptors are distributed presynaptically in axon terminals and postsynaptically in neuronal cell bodies and dendrites throughout both the central nervous system and the peripheries. So within the central nervous system, they've got a high concentration within the anterior cingulate cortex, the primary somatosensory cortex, periaqueductal gray, rostral ventral medulla, locus ceruleus, limbic system, and the substantia gelatinosa in the dorsal horn of the spinal cord. This is basically a lot of the parts that are involved in pain control and in mood and the reward centers of the brain. And in terms of the non-sort of central nervous system or the peripheral system, their opioid receptors are present in the peripheral terminals of sensory nerves. They're present in the gastrointestinal autonomic nervous system, in cardiac tissue, baroreceptors within carotid bodies and the vagus, and mechanoreceptors of airways and lungs. So if you kind of think of also where opioids act and what are the side effects are, you can kind of then think about where the receptors must be located to have those effects. If we think just more sort of individually about each receptor, the mu receptor has 3 subtypes, and it's the most highly expressed of all the opioid receptors. The endogenous ligands, beta-endorphin, endomorphin 1, and endomorphin 2. And when they're agonized, it's responsible for most of the analgesic effect of opioids, but also for some of the side effects and adverse effects, such as respiratory depression, cardiovascular depression, sedation, nausea, and constipation. And the fact that opioids have or develop dependence and tolerance in people is also thought to be due to persistent activation of the mu receptors. The kappa receptors have 3 subtypes as well, and their endogenous ligands are dynorphin A and B. And agonism of the kappa receptors are thought to result in some analgesia, but also sedation, dysphoria, and meiosis. The delta receptors have 2 subtypes and are less widely distributed. They're mainly found in the olfactory bulb, cerebral cortex, and caudate putamen, and their endogenous ligand enkephalin. And agonism is thought to result in some analgesia, but also decreased gastric motility and constipation. And the NOP receptor has just the 1 subtype, and the endogenous ligand is nociceptin or orphanin FQ. And agonism of this is thought to result in hyperalgesia at low doses, but analgesia at higher doses, and is also implicated in the development of tolerance to opioids. And finally, coming to the opioid receptor activation process. So like any G protein coupled receptor, once the ligand binds to the opioid receptor active site, it causes conformational change of the receptor. And this activates an intracellular G protein. And this is an inhibitory protein in the case of opioid receptors, which inhibit voltage-gated calcium channels, inhibits adenylyl cyclase, and this results in decreased cyclic AMP production. And it also activates potassium channels, which results in hyperpolarization. And this results in reduced neuronal excitability and inhibits release of neurotransmitters such as glutamate and substance P from nociceptive fibers. So, as I've said before, the opioid receptors are located presynaptically and postsynaptically. So, presynaptically, the mechanism is thought to be mainly through the inhibition of neurotransmitter release. For example, if we think about the periaqueductal gray, which is in the midbrain, this is involved in central control of nociceptive transmission. And the pathway from the periaqueductal gray to the spinal cord is called the descending inhibitory control pathway, as it inhibits nociceptive transmission within afferent fibers. So at rest, we know that GABA inhibits the efferent outflow from the periaqueductal gray, and this reduces anti-nociceptive outflow. So activation of the opioid receptor inhibits the GABA, which stimulates anti-nociceptive outflow to the spinal cord, which results in analgesia. So inhibits the inhibition or the inhibitory stimulus that GABA normally results in. Then coming to postsynaptically, the opioid receptors inhibit neurotransmission by hyperpolarizing neurons, mainly via activation of G protein-gated inwardly rectifying potassium channels. And this reduces neuronal hyperexcitability and thus reduces nociceptive impulse.
Great. Thanks, Maddie. So again, this question, as I mentioned before, explored in Viva settings, and reasonable understanding of opioid receptor is expected from the primary candidates. So well done. So that's the end of our today's snippet. We'll be back with another snippet in week's time. Till then, goodbye and have a nice time.
Thanks for listening. See you next time.